Assalamualaikum. My name is Adima Nayat and my roll number is BP16510 and I am from 5th year morning. The topic which is assigned to me is a drug that is albendazole. The question first arises is what is albendazole and in which conditions we are prescribing this drug and what are its indication, bioavailability, etc. So, albendazole is a benzimidazole and helminthic. Benzimidazole is basically a class of drug that is used to treat parasitic infections mainly. So albendazole is also used to treat parasitic infestations such as giardiasis, trichuriasis, etc. It has bioavailability of less than 5%, elimination half-life of 8 to 12 hours, and it has hepatic metabolism. The picture which is shown below is basically a chemical structure of albendazole. Now, what are the indications? Albendazole is associated with many diseases. These all diseases are mainly parasitic, such as neurocystic cirrhosis. It occurs due to Taenia solium. There is a poke tapeworm, cystic hydrated disease of the liver, lung, peritoneum that is caused by the dog tapeworm, Echinococcus granulosus. Strongyloidiasis that is caused by a roundworm, ascariasis of small intestine caused by Ascariasis lumbricoides that is also a roundworm. Trichiasis, it is basically an eye disorder. Gnathostomasis infects vertebrates caused by Gnathostoma spiniferum. Microsporidiasis, it is an infection. It infects the intestine, lung, kidney, brain, and eyes caused by Microsporidia. Cutaneous and visceral larva migraines. Now, what are the adverse effects? Albendazole may cause headache and normal liver function in 10% individuals. It also increases liver enzyme to 2 to 4 times of normal level, occur in 16% patients, those who are receiving the treatment for hydrated disease, and it goes as the treatment ends. Over 1 to 10% of people experience abdominal pain, nausea, vomiting, dizziness, and vertigo. Increased intracranial pressure, meningeal signs, temporary hair loss, and fever. The headache, nausea, vomiting are thought to be caused by sudden destruction of cystic cerci, that is a tapeworm larva, and it causes acute inflammation. Only 1% of people are or less may be associated with hypersensitivity allergic reactions, that is rashes or hives, leukopenias, thrombocytopenias, pancytopenias. Pancytopenia is basically a drop in all of the WBCs, RBCs, and platelets. Hepatitis, acute liver failure, and all these diseases. Treatment of neurocystic cirrhosis with albendazole may also cause neurological side effects such as seizures, increased intracranial pressure, focal signs caused by inflammatory reactions such as that occurs when parasite in the brain kill. The steroids and anticonvulsants are often given with albendazole to treat such side effects. Those being treated for retinal neurocystic cirrhosis can face retinal damage, so they have to first check ocular cystic certi. Albendazole can also cause permanent blindness to patients who are taking it for retinal cystic cirrhosis. Now, the contraindications, albendazole is contraindicated in conditions with known hypersensitivity to benzimidazole class of compound, that is albendazole itself, and pregnancy. There are several drug interactions which causes severe side effect or not so severe but side effects with when interacted with albendazole. Sorry. So first of all, dexamethasone. It increases plasma concentration to about 56% by inhibiting the elimination of albendazole sulfoxide. Cimetidine and pensequental, when interacted with albendazole, increases plasma concentration. The interaction of albendazole with anticonvulsants, anticoagulants, OCPs, othiophylline, and oral hypoglycemic may induce CYP 450 system. Albendazole, when interacted with aminoquinones, it decreases the serum concentration of N-helminthics, and when the antiparasitic praziquantel increases the plasma concentration by 50% when interacted with albendazole sulfoxide, and increases the AUC by 75%. What are the irrational uses of albendazole? Now, basically, what are the irrational uses? So, the irrational uses are the overdose or underdose of the certain drug that is the provided by FDA or WHO. So, the irrational uses of albendazole may also cause alopecia, transaminase elevation, and neutropenia, pancytopenia that may also lead to death from septic shock, bone marrow problems, cystic fibrosis involving the eye, and it also increases liver enzyme, liver diseases, and the patients who are treated with albendazole for neurocystic cirrhosis should also examine for lesions in the eye. Now, the dosage of the albendazole, the recommendation for neurocystic cirrhosis in patients with more than 60% 60 kg of weight, 400 mg POBID for 8 to 30 days, less than 60% 60 kg weight, 15 mg per kg per day divided BID PO for 8 to 30 days. This dose cannot be exceeded more than 800 mg per day. For hydrated disease, the recommendations are 400 mg POBID at 28 days, then 14 days drug free in 3 cycles for patient who have weighed more than 60 kg, and the patient who have weighed less than 60 kg can take it in 50 mg per kg per day divided by IDPO no more than 1800 mg per day for 18 days, then 14 drug free days in 3 cycles. In other diseases such as cyclostoma, ascariasis, hookworm, trichostrongylus, capillariasis, larva migraines, visceral enterobius, 400 mg, 400 mg for all, fluke 10 mg per kg PO Q day for 7 days, gnathostomiasis, microsporidiasis, 400 mg BID for 21 days. There are so many brands that is available for albendazole, but the main are Albenza, Albendo, Alovec, Bendazole, Zidol, Zavec, Zental. Now the comparison of these brands in term of price is Albenza, Zidol, Zavec, Bendazole are cheaper than Zental and Alovec because Alovec is 36 rupees and Zental of 20 rupees. In terms of efficacy, to assess the efficacy of the brands, we should perform different physiological tests such as hardness test, dissolution test, and there are so many tests to perform these efficacy to prove the efficacy of the drug. But Albenza is the most recommended drug brand for albendazole, and Zental is an unapproved. Uh, uh, Basically, it is not used so internationally. The alternatives for albendazole are ivermectin, nitazoxanide, parental fumoate. These drugs can be given in an alternative condition, and they are prescribed for cutaneous migraines, strongyloidiasis, onchocerciasis, river blindness. Ivermectin can also be prescribed for COVID-19, scabies, ascariasis, filariasis, elephantiasis, and so on. And one other drug, stromatol, can also be given as an alternative. Now, the case study which I have taken is of a 31-year-old male who immigrated from Mexico 3 years prior to admission, was brought to the ER by his family with a seizure. He had been previously healthy. Neurological examination demonstrated no focal finding. A CT scan of head shows multiple small cystic and calcified lesions. CSF analysis showed 22 WBCs with 5% neutrophils, 89% lymphocytes, and 6% monocytes. The CSF glucose was 63 mg per dl and protein was 36 mg per dl. Now, the soap notes subject is of gender male, age 31 years old, chief complaint is seizures, no previous history of medicines or diseases. Now, the object, the lab report shows CT scan of head that shows multiple small cystic and calcified lesions. CSF analysis shows 22 WBCs with 5% neutrophils, 89% lymphocytes, and 6% monocytes. CSF glucose is 63 mg per dl. CSF protein is 36 mg per dl. Now the assessment. In assessment, first we have multiple cystic and calcified lesions on head. So it strongly suggests the neurocystic sarcosis. Now, what is basically a neurocystic sarcosis? Neurocystic sarcosis is common helminthic infection of the nervous system and a leading cause of acquired epilepsy worldwide. The disease occurs when humans become intermediate host of tinea solium by ingesting its egg from contaminated food, or most often directly from tinea carrier by fecal or oral route. Neurocystic sarcosis is a leading cause of acquired epilepsy in the developing world and is partly responsible for the increased prevalence of epilepsy in developing countries. While calcification have been considered inert lesions, recent data that calcified cystic circuitry are not clinically inactive nor pathologically inert lesion, as they may cause recurrent seizures when parasitic antigens trapped in the calcium matrix are exposed to the host immune system due to process of calcification remodeling. So, as we diagnosed that the CT scan shows multiple cystic lesions can be neurocystic sarcosis. It may also be intracranial lesions, toxoplasmosis, CNS lymphoma, nocardia, metastatic cancer. But the CT scan is more strongly give evidences of neurocystic sarcosis. And in case study, it is mentioned that the patient has immigrated from Mexico. So, from studies, we have searched that in Mexico there is a prevalence of tinea sodium infection. So, for this, we have taken a biopsy sample. So the larva also, so it demonstrates larva to also confirm the diagnosis, and a stool test can also be done in which eggs are seen. In plan, the treatment starts with the drug therapy is a treatment of choice. The treatment starts with a high doses of albendazole 10 to 15 mg per kg per day for 8 days, sufficient to kill remaining living cells. Praziquantel can also be given for the treatment of neurocystic sarcosis, but albendazole shows more effective for neurocystic sarcosis. Praziquantel is also effective, but for other parasitic infections. Anti-epileptic medication and shunting for hydrocephalus are also important. And surgical treatment should also be recommended for cells that are outside the CNS. These are all the references from which I have taken the case study. Some sort of headings of indication and contraindication, but not all. Thank you so much.